The kidneys are bean-shaped organs about the size of your fist. They are located under your rib cage towards your back. The kidneys have several jobs. One of the most important jobs of the kidneys is to help your body remove toxins. The kidneys also filter your blood and remove excess water and waste products from the body 24 hours a day. Excess body fluid and waste products are excreted through urine. Chronic kidney failure or chronic kidney disease is the loss of kidney function over time. Chronic renal failure does not develop all at once, but gradually. Depending on the underlying cause, the loss of function of the kidneys, which progresses day by day, may eventually render the kidneys completely inoperable. Chronic renal failure usually progresses silently in the early stages and may not cause any symptoms. Symptoms usually appear in the later stages when the kidneys begin to lose function. Symptoms of chronic renal failure may not appear in the same way every patient. Symptoms of chronic renal failure, which can also be confused with different diseases, are generally as follows: fatigue and weakness, nausea, vomiting, impaired concentration, swelling of the feet due to excess water retention, loss of appetite, sleep problems and puffy eyes, especially in the morning, changes in the amount of urine and frequent urination at night, muscle twitching and cramps, especially at night, swelling of the feet and ankles, persistent itching and dry skin, chest pain, if fluid accumulates around the lining of the heart, if fluid accumulates in the lungs, shortness of breath, hypertension, headache, erection problems in men. The causes of chronic kidney failure can vary. Chronic renal failure can occur due to preventable causes as well as due to different diseases. The most common cause of chronic kidney failure is diabetes, commonly known as diabetes. High blood sugar levels can damage the small filters in the kidneys and trigger kidney failure. Hypertension, commonly known as high blood pressure, is known as the cause of cardiovascular diseases and stroke, but it can also affect the kidneys. Over time, high blood pressure can strain the small blood vessels in the kidneys and stop them from functioning properly. High blood pressure can cause kidney failure and vice versa. Kidney failure can cause high blood pressure. Inflammation of the kidney ducts and the surrounding structure can cause chronic kidney failure. Polycystic kidney disease is the most common inherited kidney disease. It is caused by the formation of kidney cysts that enlarge over time and can cause severe kidney damage and even kidney failure. Causes that block the urinary tract such as benign prostate or prostate cancer, bladder cancer, kidney stones, kidney cancer, infections, blood clots in the urinary tract can lead to kidney failure. Problems that stop or reduce blood flow to the kidneys, such as heart attack or heart disease, liver failure, severe burns or allergic reactions, can predispose to kidney failure. In addition to these, overexposure to toxins from heavy metals, drugs and alcohol, vasculitis, inflammation of the blood vessels, lupus, an autoimmune disorder that can cause inflammation in the organ, some types of cancer or chemotherapy drugs, unnecessary drug use. Damage to the kidneys is usually permanent. Even if the damage to the kidneys cannot be corrected, it may be possible to stop or slow down kidney failure by controlling the underlying condition that causes failure. The treatment plan may vary according to the condition causing kidney failure. Treatments can be planned for complications experienced during kidney failure. Patients with kidney failure often have high blood pressure that is difficult to control. The nephrologist may prescribe medication for high blood pressure to protect kidney function. Since high blood pressure medication may initially reduce kidney function, it is useful to increase the frequency of check-ups Patients with kidney failure often have a high level of bad cholesterol, which increases the risk of heart disease. Cholesterol medications can be used for this. People with chronic renal failure may experience fluid accumulation in the body. Drugs can be used to prevent this condition during the treatment process. In order to reduce the burden on the kidneys, a low-protein diet is important in terms of reducing the problems that may be experienced. Treatment of end-stage renal disease is in two ways. The process of cleaning the blood that kidneys that are not working properly cannot do is carried out with the help of a device. Dialysis does not cure kidney failure. However, it is necessary to undergo dialysis periodically in order to survive. Dialysis can be done in two ways: hemodialysis or peritoneal dialysis, depending on the patient's condition. It is the transplantation of a working kidney to replace a non-functioning or under-functioning kidney. Although there is a long waiting list for cadaveric kidney transplants, kidney transplantation can be performed in a short time in living kidney transplants. Patients do not need to be on dialysis after kidney transplantation. You can support us by liking the video, writing your thoughts on the subject in the comments, and subscribing to the channel for the development of the channel and more such content.